Yeah, we're going to start in just a few moments. We're just waiting for people to join. So, but welcome everyone. Thank you for joining us. Thank you, Petra. I'll start off by saying thank you, Petra, for supporting us with the admin for this. Really do appreciate it. So sometimes it's the party, isn't it, that you wait and you hope everyone turns up. So it's lovely to see that we've got so many people that are joining us. So hopefully we will get a few more people. And just for clarity, this session is being recorded. So if colleagues, just wish to note that it's being recorded, but obviously colleagues that aren't able to attend today will then be able to play this back in the future, which is great. So thank you. Okay, I'm going to kick off because obviously it's a couple of minutes past 12 and we've got lots to talk about, I think. So I'm really delighted to be supported by a number of colleagues on this panel. So if I can just introduce colleagues. So if I start off with George, would you like to introduce yourself?
Yes, good afternoon, everyone. I'm George Chunias. I'm the Early Careers Manager here at ACCA. I'm really pleased to join this call today and to share some of my work in the early career space around talent recruitment and take part in the general discussions that we're going to have today. So yeah, thank you. It's really great to be on board. Thank you.
Thanks, George. Camilla?
My name's Camilla Godfrey. I work for a national programme called One NHS Finance, which provides training and development opportunities for finance staff within the NHS. We also do a lot of work around talent and recruitment. So yeah, looking forward to being here today.
Brilliant. Thanks, Camilla. Krishna?
Hello, I'm Karishma. I'm currently at Mid and South Essex Foundation Trust. I'm a senior finance business partner and I qualified with ACCA in 2019.
Thank you. Keith?
My name's Keith Wood. I'm a Senior Policy Manager at the Healthcare Financial Management Association. I've had a varied and unconventional career, probably, across providers, commissioners, regulators, and across systems latterly. I graduated 37 years ago and I've spent 29 years in the NHS since then. I think I was referred to as the mature candidate. Well, I'm not mature, just old, as a euphemism. So I peaked as a DOF for about 10 years in the noughties and early teens. I'm currently semi-retired, working 2 days a week for HFMA, writing about healthcare finance rather than doing it.
Brilliant. Thanks, Keith. And Val?
Hi, I'm Val Kostuk. I'm working for Mid and South Essex NHS Foundation Trust. I'm Performance and Governance Manager. So one of my main kind of responsibilities is one version of the truth, which is I will probably speak to you a bit later. And I qualified as a CCA in 2024.
Brilliant. So our newbie in the team. Petra, would you like to introduce yourself and then I'll continue to just introduce myself with a bit of housekeeping.
Yeah, sure. So I'm Petra Louisa Quirembe. I am the Sectors and Communities Manager here at ACCA for the public and not-for-profit sector, as well as the health sector. And I have put together this talking series session, as well as 4 additional talking series sessions for this month and next month. And that's me.
Brilliant. Thank you, Petra. So I'm Dawn Scrafield, Chief Finance Officer for Mid and South Essex, and I was delighted to be asked to host this session and, as I said, brought some able friends along with me. So hopefully you can see the rules of the session. So obviously, please, if you could just keep yourself on mute until you are needing to be speaking or until you have a question. Raise your hand, obviously, emoji style, or put something in the chat or whatever. Please do use your hand on the function though, and I'll keep my eye out on the chat. So that's great. And someone's tested the hand function already, which is brilliant. And then obviously, please do connect, and these sessions are designed to help us connect with each other. There's probably people that you may have heard of before or come across, but please do connect with people, and the benefit of this is shared learning. So the agenda we've got for this session is set out in the next slide. That's it. So we've done introductions. I'm going to hand over to George in a second around just talking a little bit about early careers information. And then we've got a couple of discussion points that we wanted to talk about that I've got panel members that I'll bring in. And then we've got an open discussion, so Q&A, and then just a bit of a conclusion as to where we get to. So George, over to you.
Yes, thank you very much. So yes, as I briefly mentioned in the introduction, my name is George, Early Careers Manager here at ACCA. My primary role at ACCA is to break down barriers and entry pathways into accounting, but also ACCA. If we go on to the next slide, this is a recent pathways diagram or design that we've created, essentially demonstrating that there is no wrong pathway into becoming a chartered certified accountant and becoming an ACCA member. My role primarily focuses on widening access, dispelling myths to school and college leaver students, and talking to them around, there are apprenticeships available. You can go to university, take a degree and qualify. You can go a non-accountancy degree, but you can also, there are career changes that might come into profession at different parts in their life. And the overriding message is that there is no wrong pathway. And I think my role primarily focuses on school and college leavers. So the work that we do there is a lot around dispelling myths, talking around what accountants do, and leveraging the power of ACCA members. So maybe some of you on the call have been part of some of the initiatives I've done. I'm always welcoming any ACCA members that want to share their story. I know from the panelists that introduced themselves, everyone had a different pathway into ACCA, and that's always great and relates to students. And I think bringing it to the NHS, I did have someone come into a school visit that we hosted at ACCA, and everyone's talking about where they came from, and students really stood up and listened when the lady said she was to the NHS, because traditionally young people might just think of those healthcare roles within the NHS, and don't actually consider the broader sort of giant of the NHS and the wealth of opportunities that kind of are available for young people, and it's regional, so it's all across the UK. It's not just London focused, and that's what I think something that I really try and hone in on. And actually, I do for the sessions where we go into schools, and I often try and get the teachers not to say who we are, because they might guess. But I always have the logo of NHS as well as some other brands, and say, what do you think all these have in common? And if they don't know who we are ahead of the session, they probably won't guess. And when I say it, then it kind of lights a spark in them and think, oh, okay, so if you said these, where else could I go? The work that we do. So if we go on to the next slide, as I said, I'm focusing on school and college engagement, and some just latest statistics from the CIBIL UK 2025 school leaver survey of 2,000 young people showed that 18% of school leavers were interested in apprenticeships. So 3 years ago, it was around 9%. So, there's a dramatic increase. Doesn't mean these people are going to take an apprenticeship route, but the interest is growing. And interestingly, accountancy was the second most popular option behind engineering. So there's lots of great work being done there. There is, the why I've put in there. The second bullet point, the success of the progression to level 7, we all know the recent announcement, so we're not 100% sure how that is going to affect. There will be effects on that. The main thing for the level 7, that it won't affect this year's intake. But our overriding message when we are going into schools is there's all the different ways that you can go and become ACCA qualified and have a fruitful career in accounting and finance. Some of the ways that we do engage with students, so I've talked about face-to-face events. We do a variety of online things. Recently, well, not recently, 6 months ago now. It feels like recently because it feels like it was yesterday. But we'd had a really successful Twilight webinar series, And again, you know, if anyone is interested, and I think it was mentioned at the start, do feel free to connect with me, because we're always looking for members to share their stories. And we did a series of 4 Twilight webinars where we had over 1,000 people join throughout the 4 sessions. And that wasn't just targeting young people, because we know, you know, with this, we look at the sphere of influence. So yes, you have the young people. We also need the parents, guardians, caregivers who are going to be relaying that information, but also educators, so school teachers and careers advisors. And another area that we're looking to increase engagement and awareness of, so if we go to the next slide, please, is the T-levels in accounting. This is England specific, but really interestingly, with the T-level in accounting, if we just go one on, please. T-level in accounting is for 16 to 18-year-olds after GCSEs. It is equivalent to 3 A-levels, and there is a specific T-level in accounting. Now, if we click to the next one, so the T-level in accounting was specifically designed by employers and providers to meet industry needs and prepares students for entry-level roles into skilled employment, apprenticeship or technical study. Some do go on to university, but the main pathway is to go into an apprenticeship. And recently there was a statistic that those studying a T-level in their chosen subject, so there's T-level in accounting, there's health and social care, there's marketing, there's a whole range of subjects that could be taken. 70% that take that T-level in their chosen subject, they remain in that. And the importance of that is because if we go to the next part, for those of you that are not aware, and I do appreciate some are aware, and again, I'm caveating it that this is for England. Within the 2-year program, there's a 45 days of industry placement. Now, at ACCA, we try and increasing awareness and engagement for employers with the T-level in accounting, because there is this 45-day placement, and there's over 40 colleges around the UK and England that are offering this at the moment. And when I've been to various T-level conferences with the Department of Education, I've often sat, not surprising, I've often sat next to people from the NHS, and they take on a lot of placements for those in health and social care. But I've never really heard about accounting. And I mean, that's just from the conversations that I've had. And we really think that this could be a real opportunity for people working within the NHS and that have that, you know, potential to offer placements to students. It's 45 days. It's very flexible. I won't go into the granular details, but it's not like there's lots of flexibility in how the placement could be delivered. And given how widely spread the NHS is, there would be a college near to one of the establishments where you're working at, or anyone that's listening to this back. And the colleges themselves, they have like placement officers, and again, it gives that sort of talent opportunity and a pipeline for those that are interested in apprenticeships and kind of building out that career. So my main call to action for everyone on the call, and I know there's lots of good conversation going to come after, and hope that I can share some insights, other things that ACCA do and can support. That if anyone is interested in supporting any of the early careers work that I do with schools and colleges, but there is also a university element where we go to universities and promote the ACCA Advantage program. There is a university team. Please do feel free to connect with me, because I can put you in touch with those. They do site visits across the UK, and equally for me, and when we have stuff in London or stuff remotely, it would be really good to have people that are passionate about ACCA finance, but also working within the NHS and kind of dispelling some of those myths to join me. So yeah, thank you very much. And yeah, if there are any questions, I would take them or wait to the end. And yeah, please do connect.
Lovely, thanks, George. So what I'm going to do is perhaps encourage people, if they've got questions directly for you, George, to type them into the chat if you can, but there'll be 100%. Questions, Q&A at the end. That'd be brilliant. Okay, so Petra, you've kindly got, as we move into the discussion section, I believe you've got a question for this first part of the discussion.
Yes, I do. I will launch the poll.
No problem.
Okay, I'm hoping this works.
Okay, so for people that are on the call, so including my panel colleagues, please do perhaps pop in why you think the health sector is a great place to work, or indeed if you don't work in the health sector and you've joined this chat just because you're a little bit curious about what this is all about. Perhaps your perception from what you've heard or what you've seen, and perhaps if you could put your answer at the front, just say your perception is it's a great place to work because, and it would just be interesting to see where that varies in responses. So that's in the chat. So perhaps what we'll do is we'll start some discussion, Petra, and then we'll see how the feedback goes on that. Perfect.
Yeah.
So Camilla, I'm going to start with you, if that's okay, because I think it's probably helpful to kind of frame the discussion where I bring in colleagues that work in the NHS with a bit of an overview around some of the stats for the NHS. So is that okay, Camilla, if you could just kick us off?
Yeah, absolutely. Is the slide loaded or shall I share it? Oh, here we go. Perfect, thank you. So this is just a slide to show the current makeup of the finance function. So this is based on a biannual census that we do through One NHS Finance, but also the Skills Development Networks and the HFMA. This one was conducted in autumn 2024 and shows the data as of the 30th of September last year. So the total number of finance staff in the English NHS at the moment is 15,833. This is up from 2022 by 335 people. The vacancies have decreased since we last did the survey, so they're now at 889. In 2022, they were at 1,106. So that's a good decrease in terms of vacancies. We've also dropped in terms of agency and seconded staff from 380 in 2022 to 125 in 2024. Some stats on kind of where people are working. So we've got 56% of finance staff work in financial management. We've got 62% of staff within the English NHS are either qualified or studying for a qualification. And in terms of headcount, again, we've seen an increase across providers, but NHS England regional teams, CSUs and ICBs have all seen a decrease. On the gender diversity, overall the finance function workforce is 61% female and 39% male. This is down slightly from 62% female in 2022. At director level, we've got 39% female, which is up from 33% in 2022, which is brilliant. It shows that some of the work that we're doing across all our programmes is making a difference to diversity. But there's also a lot of regional variation in terms of gender split across the country, which is something we know we still need to work on. And then finally, just on ethnic diversity, so 74% of the workforce identified as white, which is down from 2022. It was 76% back then. And then at director level, the proportion of white individuals remains high, which shows that we still have a lot of work to do in this area, but definitely moving in the right direction from previous censuses that we've taken.
Brilliant, thank you, Camilla. And I think what that does is it really gives us a nice shape of the huge breadth that is available in the NHS in the finance function and skills. So Keith, can I come to you? Because I think obviously with your experience, you've obviously seen lots of evolution and change. So I'm just interested from your point of view around your experience in finance and the development and also the training opportunities.
Well, yeah, and I can't speak on behalf of the whole of the NHS, obviously, because it's a huge and diverse organisation. But the experiences that I've come across is that the NHS is actually a very, very good, can be a really very good organisation. Doesn't quite work as an organisation to work for if you want to develop. So okay, I came in as a graduate, but as a senior management accountant. And if you back yourself, if you invest in yourself, the opportunities are there for development. But it can often be down to you. I mean, when I got into a leadership position, I thought it was very, very important to take the personal development process very, very seriously. From a personal level, you do more than the bare minimum. But from a leadership perspective, I guess I was slightly unusual. I made sure that I had a one-to-one personal development session with every single member of my finance team, not just the ones that I line manage, every single person. And the payback that has is absolutely immense. You work out what they want to do now, what they want to do in future. And for some, that's exactly the same thing. They're there to do a job. They're not interested in a career. But others, you get to work out what they want, and where, what development they need to be able to get to where they want to be. And that's absolutely fundamental. The NHS, and it goes through its swings and roundabouts of growing and shrinking, but ultimately, there's going to be a need for an NHS finance function. It will change over time. These individuals that you've got in-house at the moment they're there, they're important. And if you invest in them, that pays back a huge amount in terms of loyalty and commitment. And nothing I think speaks more than having a sort of committed team that will genuinely go the extra mile for you when things get tough. If I can just sort of add one other thing, it's around the perpetual change that the NHS seems to go through. It's not a great advert for a career in the NHS, but believe me, if you're good, if you back yourself, you invest in yourself, you'll be there until you want to not be. So I think the NHS is in my experience, has been a great place to work, and to develop, and work towards your interests.
Brilliant, thanks, Keith. And I certainly would agree for that. According to my own experience of being in the NHS now for almost 29 years, there's certainly never a dull moment. Lots of learning opportunities, and I've got two colleagues here that will share some of their learning opportunities, no doubt, and their experiences. So, Val, should I go to you first and then Krishna? So, what are your reflections around working in the NHS, developing your career, and obviously Val more recently in from being qualified. What's your reflection?
In 2 words, I absolutely love it, Dawn. It's such a great place to work, and it's not only from a point of because the NHS is non-for-profit. So what we have you have the ability to see. Obviously, we've got the budget and envelope, or we have the monetary amount, but also you can see the benefit we bring to our society. We get our community healthier. So those 2 elements makes you can see how your work inputting and benefiting your community. So one of the things what I want to say is and this is one thing what it was when I started an NHS career is the complexity of NHS. So when I started, I was privileged enough to move between various departments like financial management, financial accounts, and I also was benefiting to be part of the team who created lots of complex chart of accounts and bring the 3 hospitals during the merger together. So that give you the exposure to how we're producing the final accounts and how we are using the big data technology to create the visibility. So one of the kind of aspects what is very, very, I find is very helpful for me is when you're moving between different areas and the different departments, you understand the complexity. And then when you bring all the data sets and the data together through the technology, it helps the executive team to make a decision to improve the healthcare in the region. So yeah, it's a really, really nice place to work, and don't underestimate. There's always the places to learn new stuff, and yeah.
Oh, brilliant, really helpful, Val. And I think one of my reflections as well, and ACCA is obviously a global opportunity for accountants to train and learn. So we're obviously sharing our insights from the UK, but obviously ACCA, there's learning beyond, that from other countries that we can compare through as well. So you talked there, Val, about some using big data and using information, and obviously the NHS, we've got a wealth of information which allows us to do some of that benchmarking, but also drawing together the business aspects, like you say, that help with some of that analysis to improve population health. So, really, it's a good environment to be able to draw that opportunity from. So thank you. Krishma, really good to get your reflections. So
yeah, I think for myself, one of the areas that I think is truly amazing is how much the NHS supports professional development. For me, myself, I went to university, I studied an accountancy degree, and then I decided that I would take a placement year, and it was an NHS placement year that I would manage to get into. And that sort of gave me that insight into, what, this is something that I would like to take on going forward. This is a career that I would really love to get into. And I think one of the big benefits of the NHS Trust, a lot of them have a lot of support with funding ACCA qualifications and having studying time available to be able to do your studies as while you're working as well. And that was one of the perks that I found in my career. And that's really helped me and supported me to get to where I am. And it's not just meeting your qualifications in ACCA, it's also the ongoing CPD. So one of the really good aspects of ACCA is that ongoing lifelong CPD requirements that you have to fulfill. And it is something that you can do day to day in your job, and you're meeting all of the sort of technical skills that you need to be as an accountant, but also getting all of the exposure that you would get in your day-to-day work as well.
Thanks, Karishma. So, you make a few good points there around the opportunities for growth and learning. And one of the things, certainly in my experience, is about attracting talent to the NHS. We know that often when you're, when people are training, they get attracted to the bright lights of the big four companies and looking at the growth and opportunity there. And sometimes it's hard for people to see, obviously, what the opportunities are in the NHS. And as Val, you've set out some of the opportunities around understanding, looking at information costing. So we have quite a wealth of costing information. But we sometimes struggle to attract costing accountants in the NHS. Keith, it would just be interesting to get perhaps your reflections around some of the strategies and solutions or approaches perhaps you've gone about to attracting talent in the NHS.
Well, I have to say, from a starting perspective, I am a product of one of the what's now one of the big four. It wasn't at the time, and came in qualified. But the NHS's ability to offer the variety that it does. It is a megalithic organisation. When you're talking a £200 billion budget and it's just almost 16,000 finance staff, that's a huge base on which you're building. So you've got a huge amount of variety, you've got a huge amount of opportunity. One of the things I think, having experienced less than good employers outside of the NHS, is how reasonable and fair the NHS is an employer. It can't do things unto you that are divisive. There's method in the madness of the management of people, which is a great and stable place to be. I know it has the bad reputation of being always in perpetual change, but that creates opportunity at the same time. So it comes back to that idea. Don't see the change of the NHS as a threat. There are really, really good reasons to want to be involved in this one. And I'll tell you what, most people have miserable COVID experiences. I have to say it was a highlight in my career. I was involved in the management and distribution of PPE, so those FFP3 masks and surgical gowns, all that was down to me and a couple of colleagues on a regional basis. There is nothing that gives you a buzz at the end of a day of knowing you have solved a problem that has helped quite literally hundreds of patients, or a case that you've put together that means you're developing a service that means people will be a recent example, I guess, was the targeted lung health check project that I was involved in. So far across the country, that saved almost 1,400 lives. You don't get that in other areas of finance. It's an easy call.
Thank you. Thanks, Keith. So Petra, I'm just mindful actually, would you mind putting in the chat the second question we had, or a couple of questions linked to this, and then perhaps at the end what I'll do is I'll get you to share the results from both of the questions from the polls that we're setting up. So just relevant to this part of the discussion, you know, have you got a career plan? And you've heard Keith talk about, you know, the types of things that really interest you, and you know, being an accountant isn't just about accounting the numbers in the NHS. It's about seeing the impact. We've heard from that from Val as well. I guess I reflect back to some of my own experiences, and I, like Keith, joined I joined the NHS and at the very start of my accountancy journey, having been a nursery nurse before, but that's a different story. And when I joined, I worked my way up in the NHS through my accountancy qualification and then experience. And one of the things I've heard in my career is sometimes people from outside of the NHS feeling that perhaps they can't join because they don't have NHS experience. And even we get that within the NHS with some colleagues that are experienced in part of the NHS, for example, in a provider landscape versus perhaps more the regulatory part, which is a different part of the NHS as well. And I guess one of the things that I would encourage people to think about, certainly, you know, colleagues with ACCA qualification, so you will know from your training that there is the hardcore part of accountancy, as I would describe it. Every organisation has a set of accounts. Every organisation requires that kind of reporting according to international standards. But actually, the piece that I think is most exciting within a public service is the skills around the costing, the interpretation, the understanding. You know, if you're spending more in delivering service, are we actually gaining the service that we would expect? What does that look like for the population? How is that converting into benefit? What do the value add look like? And we start to explore a different type of accountancy compared to that, you know, the conversations we're having now globally around sustainability and what does the green agenda look like. Some of the public sector thinking is a bit more versed with that, albeit more challenging because we're starting to understand some of that data. So from that perspective, I'm going to perhaps suggest maybe Karishma, you could share some thought. Oh, Keith, you popped your hand up. You can go back.
Yeah, I was just going to sort of chip in the idea of sort of against it's investing yourself. I don't have a career plan, and I've always felt guilty about not having one. But if you do back yourself, if you do invest in yourself, then you put yourself in the frame when opportunities come up. I came in as a qualified accountant and got to a director of finance role. That's nothing. And I'll take this one outside of the finance, but Dawn will know one of our local acute chief executives started as a porter. That's the opportunity. Yeah, does he work hard to do it? Yes, but talent and hard work, the NHS will help you deliver. Sorry, that was it.
Oh, brilliant, thanks Keith, and yeah, I agree. Krishna, come in there. So
yeah, I think just the size of the NHS, there just means that there's so much opportunity to be able to work in many different sectors. So like for me, myself, I'm currently working in a hospital setting. I've worked in an ambulance setting previously. I think there's so much opportunity to be able to cross around different sectors of the NHS and learn. And it's not even just about the role that you're in. There's a lot of scope now to be able to do more job sharing or job rotations. And that might mean, you know, you spend some time working within costing, or you're able to look at income and not just then be focused on that area that you're sort of aligned to. So I think there's a lot more opportunity out there as it stands at the moment to be able to really hone on all of the skills that you need. And that really helps towards your leadership in the future as well, because you've got so many different skills that you'll be able to bring to the table and insights in the way that you look at things. I think there's just a lot of opportunity out there and available for a lot of people.
I agree, Krishna, and I've seen Nettie's comment in the chat as well around you know, trying to get the importance of getting that work-life balance, and I think, you know, I've got on the screen, I know a lot of passionate people about reflecting their experiences working in the NHS, but I'm also acutely aware that it's not an easy environment, because it is hard work, because it's a 24/7 service, it's a public service. So therefore, often people are giving more potentially than what you would perhaps give when you operate in a commercial sector. And you're right, Nettie, there's something about choices that people make, but that shouldn't mean that we shouldn't be supporting, people that are working in our teams to get that right work-life balance. And I think, like all anywhere anybody works, whether it's public or private sector, it's really important to get the sense and feel for the environment that you're working in. There are good teams and there are good approaches to kind of managing flexible working and the approach. And there are teams that perhaps have a slightly different approach, which perhaps, we make choices about whether or not that's something we wish to continue to do. So you're right, Nettie, there isn't a one size fits all, but certainly in my experience, people often tend to give above and beyond in the NHS because of that personal kind of commitment. I'll come to you, Keith, and then Val. It's good to get your thoughts before we reflect.
Sorry, I'm bossing it here, aren't I?
That's right.
Yeah, I was going to say the NHS is pretty darn good, I think, actually, at judging people based on the outputs rather than the inputs. And there are some places in the NHS that do have long hours cultures, but there are also plenty of others that do expect you to have a reasonable work-life balance. And I certainly think if you think the private sector is going to be any easier than that, I'd have to say, based on my experience, and yeah, I'm an old dog, and we lived a long hours culture in the presenteeism and all that. But actually, I don't think the NHS is as onerous as the private sector, if on average. But there's room to work on.
Room to improve, definitely. Actually, I'm going to bring Camilla in before I bring you in, Val, because it would just be good, Camilla, perhaps to reflect. So we're talking about wellbeing through One NHS Finance and trying to coordinate tools and things to help avoid duplicating, to try and help manage that. I don't know if you got any reflections on the kind of wellbeing point or the work-life balance point that Nettie's shared in the chat.
Yeah, so we've got numerous things through One NHS Finance, but also HFMA and the skills development networks that we do. So there is a kind of wealth of wellbeing resources and opportunities that people can tap into. We've also been doing some work around kind of flexible working arrangements. So we've got a guide around flexible working that people can read. It's on our website. I can put it in the chat if that would be useful. But we're also starting to do more around highlighting career stories from people in senior positions that kind of work compressed hours or job shares from people that are in CFO roles. So we'll be doing more work on that over the kind of coming months, and we can share more of that. Through ONF also, we've recently launched our return to work programme for people returning from extended periods of leave. So that's another thing that we've kind of put in place to support people in terms of coming back to the NHS.
Thanks, Camilla. I mean, I reflect when I qualified back in scary 2000, ACCA supported me through my qualification, and I left as a qualified newbie into the NHS, desperate and keen to absorb more learning. But actually, as I developed my career, realising that it's beyond the kind of technical skills, and actually some of the things that we also need to develop are those leadership and softer skills to be able to manage some of those conversations and appropriately ensure that teams are supported to use the technical skills that have been learned through your professional qualification, but actually organising yourselves in a way that mean that you get the most effective return from your subject matter expertise, but also the benefit into the organisation. And that is quite difficult because some people haven't necessarily had the opportunity to develop those skills. I'm sure there's an entirely different set of academic research around, are you born a leader, or do you develop those skills as a leader? But there's something about those leadership skills and then management skills that are needed to kind of manage that situation as well, Nettie. So Val, just be good to get your reflections there.
Yeah, thank you, Dawn. There's one thing what is in my career path and in NHS, what I found is quite exciting and interesting is I was able to work in the hybrid roles. So I was able to cover multiple areas like a financial accounts, financial management, and working with the HR colleagues to create something like live data, one version of the truth. So and then what is kind of give it to me. So like what you just mentioned, you got to develop your soft skills, your management skills, but at the same time with the technology moving forward, I'm kind of currently able to learn other skills like learning the SQL coding, LIQL, the Python, DAX, other kind of technical skills when you qualified as an accountant, but you also now have to bring something into meaningful to make a decision. So right now we've got several award-winning tools, which is we're creating the daily life visibility across the hospital. On the staffing level, we're bringing the HR data together so we can see what's the staff unavailability and how do we measure the staffing level to make sure the patients are safe, and at the same time we're managing our envelope. So those two things on the NHS is very closely linked together, and just from my reflection is I'm very privileged that we have the opportunity to have those hybrid roles and develop the other skills which are bringing the benefit.
Thanks, Val. I recall we've had some interesting conversations because data tells us one story, but then it's that getting in to understand with services, the people that we work with beyond the accountancy vein is then going to make the difference, because the numbers tell you a story, but actually you need to understand what's driving some of the behaviours, and that's where it gets interesting, isn't it? Carry on, Val.
That's right.
Yeah. Cool. Brilliant. So obviously, we've got time for Q&A and obviously any other panel reflections, thinking about that recruitment strategy, thinking about, whether or not career plans, good thing, bad thing, maybe question, having a little look at what other opportunities there are for, working in the healthcare. But for now, Petra, I don't know, is it perhaps now's a good time to pop on the screen the feedback from the polls that we've had?
Yes, I will try and figure out a way how to share the results on the screen. Right, I will just read it out for the first one. So the first question was, what makes the health sector a great place to work? The one that really popped up was a variety of roles. And then next for the word cloud was the people. And then we have satisfaction, a sense of satisfaction, opportunities for growth, and the impact that it makes in people's lives. And we also have community there and the value, and I guess you have decent employers within the sector.
Okay, good. That sounds good. Will you be able to share the word cloud perhaps when we make available the stuff? Yeah.
Yeah,
okay.
I'll do that.
That sounds good. Okay, and then career plans.
So career plans we have. So the first one, have you got a career plan? We had 33% that said yes, 11% that said no, and majority, 56% said kind of.
Okay, interesting. Okay. It'll be good perhaps to reflect on the kind of and on that front. So and I think there was another part to that question as well, wasn't there?
Yeah. The second part to that question was about, do you feel that you have the tools to achieve this career plan? And 56% said yes, and 44% said kind of. So I guess we can say that there is some sort of plan for the majority of people. Yeah.
A squiggly plan. I know certainly from my own experience, I didn't necessarily have a career plan. I just had the ambition. When I was interviewed when I first joined the NHS, and I was asked, where do you see yourself in 10 years' time? And to the financial controller, I said, I'll be the finance director. So, and I almost made it in 10 years. So, yes. So
We do
a
actually
question.
have a question in the chat.
Brilliant.
From Nettie. I don't know, Nettie, if you would like to unmute and speak to it.
So I think you very kindly have answered it. But as I say, I left the NHS having done all my training there. I moved around quite a lot. And I'd say one of the things that eventually pushed me out was I spent a lot of time having mentoring from finance directors around the country, because that had originally been my plan. And most of them essentially said that they didn't have a work-life balance. I remember one of them saying to me, "Oh, it's fine because I don't have a family." I had another one that said like, "Oh, my partner doesn't work and therefore I can work all the hours, but it's okay. I only work on the morning of the weekend." And what with that, with another, obviously at the time there was political turmoil where they were changing and doing redundancies. I actually applied for redundancy and was told that I was too critical, but instead I'd have to double my work. So they made a colleague of mine redundant and I'd take it on. Unfortunately for me, I appreciate that in private sector you don't normally find better things, but I did find a job where I had better leave, better working hours, just better attitudes, better pay. I appreciate you can't get that all the time, but I'm sad to leave the NHS. I loved it. I really, really loved it. But I think we need to kind of think about the people on the ground that do work hard and do love it. You get to a point where you think, is this worth it for the next 40 years of my career? So I appreciate that it'll be better in some places, and perhaps I spoke to the wrong finance directors, but that's what really put me off in the end. So
yeah, no, sorry, Nettie. Yeah, that you had that experience, because I think you probably described the minority, but I don't think we should ignore the fact that that is some people's experiences, and it comes down to choices about what's needed. I think you're absolutely right, and congratulations, because you found the right work-life balance with your chosen path. But that's not to say that potentially in years to come, that with the experience you've gained in the private sector, with a different lens, coming back into the NHS with something, and we often find that with people coming back into the NHS. I know certainly another colleague in my team left the NHS and returned to the NHS as well. So I think it's good to get that experience in different sectors as well. So thanks for sharing your story, and hopefully you'll return to the NHS in the future. So apologies, how do you say your name? Is it Bansel or Sabit? Yeah. Did you want to go next? You're on mute, I think, though. Do you want to try? No, hang on. Can someone, I don't know, let me just see if you're on mute on the screen. You should be, try speaking now. No, can't hear you, sorry. Do you want to pop it in the chat? Would that be okay?
Well, while we're struggling for that one, perhaps I'll just add a little bit to the previous question. Yeah, there are organisations out there where the work-life balance is not quite what it needs to be. I mean, I did leave the NHS and I did rejoin, and the key reason I left the NHS was because of work-life balance. But then it was quite extreme. It was a director of finance job doing 55, 60 hours a week plus a 40,000 mile a year driving habit, and with a young family at the time, that wasn't really conducive to good weekends. I arrived home on a Friday evening, absolutely cream crackered, and would start shutting down on a Sunday afternoon because I was bracing myself to get up to leave the house at 5 o'clock in the morning on a Monday. But I left. What I did realise was, yes, it was a bit of work-life balance, working on Campy Island. Oh dear. There were so many other aspects that a nibble back at the NHS, and there I was 2 years later. And exactly. much happier with the work-life balance.
Exactly. I think the other thing is coming back to, so we're trained as accountants, we're trained technically, and you could say this actually in any career, but you kind of put your heart and soul into your subject matter expertise, but then actually on a human level, what sometimes we also need to develop is those skills to draw boundaries. Because particularly as you grow more senior in the roles, you have a responsibility not only for yourself, but also for the people that you manage. And coming back, you don't always learn the skills of management, you know, as part of your subject matter expert, as your professional qualification. And there are some people that are, you know, lend themselves more to that managerial nurture pastoral type role. And there are some people that are very happy to be the technical kind of focused around the detail, but then you still have to look after yourself in that process. And the work-life balance is just one of those tests and challenges, regardless of whether you work in the NHS or in the private sector. And I guess that it's easier to work in the NHS for more hours because the NHS doesn't ever close. And that is the challenge, because you feel compelled to contribute to that, because the people that work around you, the nurses, the doctors, are there, you know, servicing our population. Whereas in the private sector, there is a battle rhythm or a daily working arrangement that means that there is some boundaries, which, you know, it does help if you need to be clear with yourself about your own boundaries. So I think everybody's experience is different, but this is kind of lending itself to some of those soft skills that I talked about earlier, that the insight you have into yourself is just as important as being able to deliver technically the job that, you know, that you're employed to do as well. So other thoughts, other reflections? George, I don't know if you had any thoughts and in terms of some of the new entrants and conversations you have, and then I'll bring you in, Keith.
Yeah, I mean, I think I kind of briefly alluded to them. It's just around, for the new entrants, is the opportunity to kind of increase the awareness of the opportunities available within the NHS, aside from the traditional roles that one might think about. And, you know, as I say, we talk about it a lot, and, you know, where there is opportunity for any ACCA member to share their story, to kind of, and we don't just try and influence young people, it's their, you know, the sphere of influence, as I said. And I think it's those perceptions that really need changing. Yeah.
Keith?
And just to comment on work life balance. I mean, okay, now technically I have left the NHS, but in working for the Healthcare Financial Management Association, I mean, the two organisations are so intertwined, it may as well be the same. And actually, up until a couple of months ago, I was still working on the Targeted Lung Health Check project, so I was still working in the NHS. And here's a happy little moment, because I mean, I now work 2 days a week. It was 3 days a week up until fairly recently. That's a cracking work-life balance, and the reason I can do that, and one of the greatest recruiting sergeants of the NHS, is the pension scheme. So yeah, I'm delighted to say that I can still afford to eat and heat.
Yeah, good. That's a relief. Bantal, shall we try and bring you back in? Fingers crossed. No, I can't hear you now. Sorry. Okay, Joshua.
Yeah, I don't know if you can hear me. Just wanted to add around what Keith has already mentioned. Yeah, and thanks for everyone for the knowledge shared. Yeah, just to add, the NHS is in terms of pay is quite competitive. I know Kate has already mentioned pension, but when you look all around the other pay elements, it's quite competitive. I know the private sector would be probably slightly higher, but when you look at it from other elements, like, for example, pension, and other benefits that you get through working through the NHS, even discounts across the industries, is quite, it brings the whole value on a very competitive place. So, and then again, the NHS kind of balances out, regardless of where you're working, whether you're working in the countryside or in the city, the difference is not that much. So you wouldn't maybe feel affected by working in the countryside. So the pay is quite competitive. So especially for starters, if you're anybody finishing university, college, or wanting to start straight away. The NHS is quite a good place to gain experience because it's got like multiple areas and the support that is there. And then again, this has already been mentioned again earlier. The support is not just internal, it is external. We have bodies, for example, ACCA and other bodies providing support, HFMA, and others. Then there's also the other organizations, for example, One NHS Finance, providing that external support. I personally have benefited quite a lot from one of the NHS England programs of mentoring, having those mentors who can take you through their own journey, So it's quite an extensive routes and this, lots of, and there's also these conferences where you can attend, and they are open to everybody at any levels. You meet people at different levels working in different sections of NHS. So there's a lot of room for growth and development. But then I think this was mentioned earlier. It's around other upcoming financial areas where we would want the new generation to come in, things like sustainability, green finance, areas also supporting fraud, procurement, for example, and all those elements. So it's a massive area for growth, whoever wants to join.
Brilliant contribution, Joshua. Thank you so much. And I completely endorse everything you've said there. Really grateful that you managed to get your point across in the chat. So thank you. So Camilla, I don't know if you saw that I've suggested that you might want to talk about, so the question just in the chat, but in case people can't see, has come around as an outsider to the NHS working in the pharma industry. It'd be good to explore how career paths are managed. In an organisation such as mine, you can map out your career preferences, relocating, for example. How's this handled in the NHS? So I just wondered if you could start off by talking about the talent conversations that we're trying to improve some of those things, and then I can add in some other contributions. So Camilla.
Yeah, so we launched our talent management strategy back in 2023 because we saw a massive gap across kind of NHS finance professionals that they weren't having this conversation. So we're in the third year now. We're just getting the reports back through at the moment from individuals that are having talent conversations, and we're getting some really good feedback from it. So our vision is that kind of senior level staff start having conversations about talent at kind of regional levels and start moving people through secondments and stuff around different organizations to get more of a breadth of kind of career opportunities and development opportunities. But on the career path bit as well, I know the Leadership Academy are currently working on a piece of work to map out all the different career paths that are available to people through the NHS. Last time I spoke to them, they said that would be finished pretty shortly. So that should be another piece of software that people can use to start to map out their careers through NHS finance, which should be really good as well.
Brilliant. Thanks, Camilla. And that piece of work has come about because we got feedback through through the staff survey, that actually they wanted a bit more clarity. And we noticed across the country there was inconsistency with some of that. So that's something, as Camilla said, over the last 2-3 years is something that's been developing. And that was actually starting to improve the strength of consistency of approach. And obviously in that process, we're talking to people who are interested in developing. So ACCA is championed as a qualification along with, other qualifications should people wish to. So it's just working that through what's right for the members of staff that have that talent conversation. So hopefully that's answered. I'm really mindful of time. So I just want to say a massive thank you to my panel colleagues. So Keith, to Val, to Karishma, to Camilla, and to George, who's a happy surprise on the in the session. So thank you very much for joining us. I really do hope that everybody has felt the benefit of this conversation. There are some slides that will be circulated, and in there is some details for the panel members. So if you'd like to contact any of us, we'd be very happy to support you. And good luck with your career, and I hope you join the NHS soon. Thank you very much. Bye-bye.